Well, I realised that we didn't have the skills in-house to actually be able to effectively redesign processes and systems. And that prompted us in the first instance to seek a partner to work with. We worked in a small way initially with Unipart, and that showed to us the range of skills that we actually needed to develop internally. And a lot of people have said to me, what the hell do Unipart know about healthcare? But actually there's so much transferable knowledge in the way Unipart serve their industry compared to how we need to actually serve our patients. The key emphasis for me on our programme of change is actually about cultural change. It's underpinned by lean transformation, but the emphasis is on how we change working practices, but also the attitude, if you like, of staff, so that they actually feel far more engaged, they feel far more empowered, and that they are continuously improving at the front line.
We're stood in the middle of the acute medical unit in front of our communications cell. It's a 30-bedded unit. We take patients directly from A&E or from their GPs.
So with our communication cell, we wanted measures that were going to be fairly easily achieved, because we wanted people to see that, you know, we could actually change things. So we went for measures that we thought that we could achieve fairly quickly, so that would give staff confidence that, you know, what they were doing was making a difference. I thought it was going to be very time consuming, you know, we haven't got time to do that in the morning, but you have. It doesn't take any longer than what we used to do, or very little longer. But you get so much more information over to your staff, and you get so much more back from them because they can participate as well.
I think the thing with the communication cell as well, it's always there.
Yeah.
So if staff, you know, aren't on duty one day and we've had sort of messages and things, we leave them on our communication cell so they can see them when they come back onto duty the next day. So, and it's obviously there for the public to see as well, so which, you know, is another good thing.
Which they do. They all stand and
they all like to have a little look at it, yeah.
Well, I think there's an absolute tremendous scope for improving the efficiency of our processes and pathways, our care pathways. We've found, you know, we've undertaken improvement redesigns where we've reduced the number of steps from something like 48 to 24. Now, not only does that make the most effective use of your resources, both your staff and your financial resources, but more importantly, it actually delivers a better service to patients and a far better quality of service to patients.
We strive to improve the care that the patients get all the time, and when we deliver the best care that we possibly can. So having something like this can help us to see where things need to be improved, where they need to be changed, to deliver that best care for the patients.
Don't you people saying, what's, you know, we've done projects before, you know, what's different about this? Why is it going to be so radically different than what we've seen before? And what I say to them is that the fundamental difference is, in this programme of change, is that we're empowering frontline staff to make the change. We're engaging them. It's not management coming up with change and imposing it downwards. It's not necessarily totally management driven. It's about actually facilitating, enabling frontline staff to actually come out of their day jobs, give them the task of redesigning the process and actually enabling them to redesign the process.